Hello, everybody. My name is Anton Roman. I'm the technical director of Quobis. Okay, first of all, I would like to say thank you to Victor for organizing such a cool event. Okay. Okay, we only have 10 minutes, okay, so we are late, so please. This panel is about healthcare. Healthcare is one of my favorite applications of WebRTC because we can help to make everybody's life easier. To be honest, there is another application of WebRTC which can make a lot of people happy, but I'm not going to mention it today. Okay, well, so please, one of the panelists, Victor Sanchez from Mashme, had to left because he had to catch his train back to Madrid. So we have Victor Pascual taking his spot. Okay, so please introduce yourself and your organization, and then I'm going to ask you a couple of questions, and then we'll have 1 minute left for questions from the audience. Okay, Helio,
okay.
Please.
My name is Helio Fernandez. I'm a full-time researcher from the Free University of Brussels. The team I'm work now, we've been working for the past few years in developing a platform for the early diagnosis of a stroke. A stroke is an extremely urgent situation in which every minute accounts. So we've been working in developing a tool that goes in an ambulance and help us to early detect stroke. Now we are working in a platform for telemedicine, which is going to be integrated in the national e-health platform from Belgium. It's a very ambitious project in which we are going to use WebRTC.
Okay.
I'm Chris Vitek. 2.5 years ago, I was sitting in a hotel lobby in Baltimore, and Phil Edholm and I decided to put together the first WebRTC conference out in the South San Francisco Conference Center. Dean and I were on a panel there together. So it's been an interesting journey. I ended my independent career. I was 18 years as an independent consultant. In June of last year, I joined Genband. I published my book the day before, so I joined them, so it was not encumbered, WebRTC for Enterprises. We've got a number of healthcare initiatives underway that span both, not only just the ecosystems of manufacturers of hardware and software, but also the healthcare delivery systems in the United States. So we've got a very rich set of what I would call niche and boutique applications, because the big stuff in the US, you can't get off the ground with this stuff. You've got to have a small $500,000, $1 million grant, get it off the ground, and WebRTC is perfect for that environment.
Okay. My name is Leo Messi. I play soccer in a small team. Not serious. I am Victor Pascual. I am the Chief Strategy Officer at Quobis. So basically, I'm helping Anton and the rest of the team to just drive the boat towards a reasonable place. I also do some teaching here at the university. So here we have some students. So you guys are going to get a good grade for being here. And well, basically, one of my commitments is to help make WebRTC happen in the industry. So I do participate at the ITF. I do also some work in the W3C. But basically, I try to stay away from those full-time standard guys. So I try to just put my legs in the real field, discuss with customers, suffer the pain. And basically, the reason why we are here today is because I thought that would be a great opportunity for just meet people who are working in the same space, learn from one to the other, and I'm quite happy with that. So having said that, when it comes to healthcare, at Quobis, we are involved in several projects. So we are, one of the applications we are doing is healthcare or mobile health in some cases. And we'll be happy here to share some of our experiences.
Okay, so I like to ask a couple of questions to the panelists. Okay, the first one is, what are the challenges or the issues you are facing when developing healthcare applications? Okay, independently from the technology you use. And the second one is why WebRTC is so suitable, fits so well in the healthcare applications. Okay, so.
Wow. Okay, so I think there's two key issues that we run into, and the first is security, and the second is simplicity. And simplicity really bleeds into ease of access. right? So, and I'll address the first one, security. WebRTC's got a lot of built-in encryption, so that's all good. But still, there's layers above that. I mean, we actually just completed our certification with Samsung on their Knox platforms, so that now we've got a secure encrypted device that we can load our application on, so that element of the security is handled. We've also partnered with a company called Entrust. Bill Connor is an old friend of mine. He's the CEO, and he used to be a Nortel guy. I was a Nortel guy. My company was a Nortel legacy, so that's a tie-in. But anyhow, but they've in North America, the government's mandated that PIV, or personal identity verification, be used for all healthcare, government, and utilities, and they've mandated that. So if we're going to have an authenticated user, they have to have PIV access. And Entrust gives us that at the operating system level on any device. So we've really locked it down from a security perspective of many different levels. From an ease of access level, the key there is that you want to be able to deploy to multiple operating systems and not have to force people into a certain profile, because different hospitals, different doctors, different companies want different things. So we've actually patented or applied for patents for a method for delivering a single SDK for iOS, Android, Windows, and OS X, and Citrix, by the way, as well, so that we can normalize the delivery method so that when you go to build something, then you don't have to write it on 3 different platforms or 4 different platforms, all of which have different features and functions that are not normalized, and they expose themselves differently. We've done our homework to normalize that. So so simplicity and security are big issues, and we're really moving quite fast ahead on those.
I will add also in the telemedicine, there's a very big issue, which is liability. It's not so technical, but it's some problems that we face all when we are working in telemedicine. And not only liabilities, but it's the legal framework in which we are working. In Europe, for instance, there's no reimbursement in many of the countries of any telemedicine. So if the doctor talks with the patient, in not many countries they still give reimbursement of this, and it's not considered as a medical advice. So we face some legal framework here that we should also work in, and it's not so technical, and it's something that it's very challenging when you work in telemedicine. Also trust, it's a very hard market to penetrate as a new company. It's really hard to have both patients and doctor trusting the technology you provide them. That's a very big issue, because people are really reluctant, and doctors, most of them are really reluctant to change and to integrate new tools in their day-by-day routine. It's very complicated. So this is also a very important challenge we need to work with. And another challenge is specificity. Not every doctor, not every specialty needs the same kind of information. So you really need to tailor applications for each of the doctors. It's not the same sport physician. It's not going to want the same medical information that, for instance, neurologist. Each of them, they want different data. Each of them, they want to visualize the data in a different way. So that's why we need tools like, for instance, WebRTC, which give, as has been said by Dean, it provides you a contextual information. So it's not only the communication, but you can provide on top of that audio-video communication, you can add a context of information and data.
Okay. Yeah, first of all, video conferencing is nothing new, so we could do that in many years ago and spending money with that. The greatest piece in WebRTC, I think, it's data channel, because it's allowing you to do whatever you want to do with that. But the thing which is exciting to me more about WebRTC is that WebRTC is putting democracy in multimedia communications. So telcos were able to provide video services. WebRTC, yes, this is yet another technology for them, but basically some existing services they are delivering today, they're going to use that over WebRTC, but WebRTC is opening up the door to small kids, to those small organizations, to include video conferencing in their blogs, video conferencing, whatever. And I think that the same happens in the healthcare or the pharma industry. Let's face it, the pharma industry is rich. They have a lot of money. And if they did want to put video conferencing, they just put the money out there. They buy Polycoms, they buy Ciscos, and they had video conferencing here. What I think here it's really disrupting is that there are people with strange diseases that those pharma industry is not putting money on investigating that. There are companies, there are NGOs which are taking care of people, and the pharma industry is not putting money on that. And here with WebRTC, I think that there is a chance that those small kids, which no one is taking care of them, can embrace this technology and put them together at the same level. I think this is the greatest part of WebRTC.
Okay, thank you very much. Really interesting. Okay, well, I'd like to know if you are using something else than a video and audio in your applications. Okay, for example, if you are taking advantage of data channel in your application, or is something more oriented for video game industry?
That was one of the reasons we use it. We choose WebRTC, that we integrate medical data, real-time medical data in the communication between the doctor and the patient. So the doctor can see at any time the different parameters from the patient, and that's integrated nowadays.
Yeah, we're weaning ourselves off of sockets. So our next release will have data channel fully embedded. One thing that really is interesting, though, is that we look at context in telephony. We think of context as something that happens when we get a phone call, okay? But, and I'll give you some numbers. So in North America, which, so I've got that centric view, right? So we've got 400 million people. We've got about 2 million people that work in call centers. We've broken our backs over the last 25 years to give context to these 2 million people. But if I'm sick, and I've got a tablet that's got my blood pressure, my pulse ox, and my blood sugar levels, and so on, that's my context, right? Mm-hmm. So the idea there is that context doesn't necessarily need to be at the contact center. And the idea of adding context to a phone call or to telephony, it's really not about that if you're talking about democratization here. It's about adding communications to context. And it's about me looking at that tablet and deciding, do I need to call my doctor right now? Do I feel bad enough? Are the indications bad enough? Do I have enough information to be able to tell him what I think is wrong, right? So context is something that, it's not a call center thing. It is a ubiquitous thing, and that's the way that we have to change, because this technology is changing in force.
Okay, so we have 1 minute left. Maybe if any from the audience wants to ask any question, feel free to raise your hand. Okay.
Of course.
The question's to the guy from Genband. You mentioned before earlier PIV. Is that a protocol or is it a standard? Can other people use it for secure caller ID or things like that?
Right.
Or what is it?
Where it grew out of, it grew out of the secure physical access business, where a thing called a PIV card. You carry the card, it had a chip in it, and it's encrypted, and it opened the door for you. PIV Interactive, or PIV-I, is the next phase of that. So what they've mandated is not only that all of utilities and healthcare and government have to carry PIV cards, but they also have to have PIV authentication in all of their applications they use in their computers and on their telephones.
Okay, so do you have any other question? Okay.
Currently, I'm working also for a company that is enforcing communications in healthcare, but our solution, it's based on traditional ways of communicating. This is XMPP for messages and SIP for voice. And now I'm one of the persons that I'm trying to enforce WebRTC into our solution. From your point of view, what will be the strongest point for WebRTC? I mean, if I want to enforce all the company to change to WebRTC, what will be the strongest advantage?
Any media, any device, any network. You can't do that with SIP.
And without installations.
Right.
You don't need to download the
Right.
application from the Apple Store. So any potential Google Chrome user might be a potential user of your application.
And don't you think it may be future integration? You told about integrating different data streams into the solution. Mm-hmm. And well, I mean, one of my main arguments was just this. In the future, we will have a context with different data streams, and this is the way to integrate all of them without having to change everything.
And the encryption in those data streams is superior to just about anything else that you're going to find out there. It's military-grade encryption. You can't store the packets in AES encryption and then decrypt them later on. There's timestamps and elements in it that prevent that. So if you're really looking for security, as many of, and depending on the country you're in, you know, some are more secure than others, that is a huge, huge difference between traditional telecommunications and PSTN-based communications and what WebRTC brings to the table.
Okay, so I think, well, thank you very much for your participation here.